It's going to be one tough April. The experts are predicting cases to peak in Connecticut in the next 2 weeks. Next on Face the State, are we prepared? We get answers from Hartford Hospital CEO Jeff Flaks and Senate Minority Leader Len Fasano. And I'll ask him why he's not seeking re-election. How are small businesses coping? What help can they get? Anthony Price, small business advocate and lender, is with us. It's all straight ahead this Sunday, April 5th, 2020.
From Eyewitness News, Connecticut's most watched local political program, this is Face the State.
Good morning and thanks for joining us. I'm Dennis House. Another day of sobering news in the coronavirus crisis, as you just saw on Eyewitness News this morning. So many people are wondering, how prepared is our state as we approach that peak period of infections? With us now, the CEO and president of Hartford Healthcare, Jeff Flaks. And Jeff, good to see you back here with us again on Face the State this morning.
Thank you, Dennis.
I want to ask you, first of all, let's talk about this peak. When do we expect it to hit?
So, Dennis, you know, there are numerous models that are in place, and the truth be told, we're not certain. There are some models that suggest it's in the first few weeks of April, and there's other models that suggest it could be longer. We're refining these models every day and certainly preparing for the surge in the very near term.
Jeff, someone asked me the other day, when does a coronavirus patient end up in the hospital? We know that they get tested first, and then they get the test results back. They self-isolate until that period, right? So at what point do they go to the hospital, and what happens to them then?
So it's on the advisement of their physicians. It's through care they get in the emergency department. And ultimately, it's a clinical decision based on where they need that hospital level of care. So most importantly, it's for people to stay close to their providers. And to seek medical guidance. As you know, we do have a 24/7 hotline that's set up. If you go to our website, hartfordhealthcare.org, that connects people in the community to clinicians 24 hours a day, 7 days a week, to assist them in getting that guidance.
And you do have stories of survival, people getting coronavirus and recovering from it, correct?
Oh, absolutely. First of all, many people in the community are being treated successfully, honor their quarantine, and ultimately succeed and come back to their workplace if necessary, if they're healthcare workers. But we've had 65 people who were admitted patients within our system, treated, and ultimately released back to home. So many people are being treated successfully and returned to home and in some cases even to work.
What is the capacity of Hartford Hospital right now?
So across Hartford Healthcare, we have 7 hospitals, really 8 hospital campuses. We're standing up our capacity dramatically. So we alone are adding 1,097 additional beds to our system during this crisis. So all hospitals across Connecticut have been challenged by the governor, and an expectation has been set that we increase our capacity by minimally 50%. So I'm very proud of the way health systems across Connecticut are stepping forward, and I think the guidance from the governor was very critical. It's the right thing to do, and we need to be prepared and ready, and we've had a window to increase our capacity to the extent we can.
Jeff, I have some friends who work at Hartford Hospital, and one was telling me this past week just how difficult it's been, but no one's complaining, though, that they're working so hard, they're working extra hours. Walk us through the day of a nurse at Hartford Healthcare right now.
Dennis, the resilience of people who work in healthcare today is absolutely amazing to observe, to be part of. People work in healthcare are heroes, and they're heroes every day, truth be told, but it's never more apparent during a crisis like this. To see the bravery, the courage, the empathy, their expertise is incredible. I just a few moments ago was rounding on one of our campuses, and I met with our colleagues, our team who's overseeing and administering the testing sites and our drive-through testing sites, and to see their commitment to being here for our community, the way they're caring and protecting themselves, and at the same time making our services available to the people in their time of greatest need is amazing. So our teams are rallying together, they're supporting each other, they're following every possible precaution. We've put precautions within our buildings. To enter our buildings today, every staff member has a thermometer and has a temperature test. Every staff member is wearing a mask within our facilities today who are clinical staff. So there's many precautions being taken to both protect the team, the healthcare team, and the people we're caring for. But these are intense situations and almost in many ways unprecedented.
What happens to a doctor or a nurse who is exposed to a COVID-19 patient? Does he or she then go home to his family, to their family? Do they have to be isolated for a while? How does it work?
So we have protocols that are in place that involve testing and ultimately isolation. I'm very pleased that across our system there's been very few examples today in these early stages of people who've been exposed in the healthcare environment. But again, it's happening within the community and it can happen within our facilities. But when people are exposed and when we learned that they're symptomatic, we do have protections in place to ensure they're not in the clinical care settings.
Do you have enough equipment in terms of masks and ventilators right now?
So we've done a great job. I think across Connecticut we've done a great job. First of all, the state of Connecticut's a wonderful partner. They're scouring the globe. The governor and his team, Josh Gabel as Chief Operating Officer, Paul Mounds as Chief of Staff, everybody's working in complete partnership with the hospitals and health systems across the state to get as much personal protection equipment to Connecticut as we possibly can. At the same time, organizations like ours, we have a 24/7 team in place. We're importing it daily. We're as well situated as I think we can be at this moment under these circumstances. But Dennis, it's a tough issue. We're competing against every other state government, every other federal government, and we're competing against other countries. So we're using every tactic we can to make sure we protect our staff during these really very difficult times. You do mention the issue of ventilators, and I do believe that's an area that's got great focus today. The Ford Motor Company is now committed over the next 60 days to create 50,000 additional ventilators. GE Healthcare has made a similar commitment of 50,000 ventilators. So we're seeing kind of the American industrial complex pivot and start to create more ventilators. That's going to be really essential as we go forward, and it's an area that we have to do even a more focused effort to bring more ventilators to Connecticut so we're maximum prepared.
In your judgment and based on the knowledge that you've been receiving, when do you think things will start to return to normal?
Well, let me first say, when you look at the effort by the state, which I really have to commend, we set up a field hospital from FEMA of 250 beds at Southern Connecticut State University. We're setting up at the O'Neill Center on Western Connecticut State University campus a field hospital. We're repurposing a former hospital in Stamford to accept patients. And we've deployed 25 patient bed Connecticut National Guard hospitals to 3 different campuses across the state. So I think there's great preparedness, and I think there's a tremendous effort to ensure that we're adding capacity and capability, and we're bringing in workforce, volunteer workforce, retired workforces, doing all the things that have to be done so we're here when the moments matter most. I think it's very difficult to suggest when we return to normal, but the need to continue to focus around social distancing, to follow the guidelines and the policies that have been put forward by the state is very critical, and the executive orders that the governor has laid forth are absolutely essential to our ability to respond to this crisis the way we need to.
Always great to see you on Face the State. Have a great Sunday, Jeff, and stay safe over there.
Thank you, Dennis.
Jeff Flaks from Hartford Health, the CEO and the president. In a moment, staggering numbers on unemployment. And next, a well-known politician in our state is calling it quits. We welcome you to watch past editions of Face the State. And there is some great coronavirus information on our YouTube channel right now and on the WFSB app.